Hi, everyone. Thank you for having us today. Today, we're going to be talking about mobile crisis intervention services. My name is Jasenia Casiano. I work for the Child Health and Development Institute. We are the Performance Improvement Center for Mobile Crisis Intervention Services. And today with me is my colleague, Yvette Cortez from DCF, and I'll turn it over to her.
Hi everyone, this is Yvette Cortez. I work for DCF in the Division of Community Mental Health. I'm a program supervisor, and I oversee the mobile crisis program for the state. So we're going to start off today by talking about what mobile crisis does. For those of you who don't know, mobile crisis is a group of clinicians. We have 6 agencies in Connecticut who offer mobile crisis services, and each one of them has a group of clinicians that are available to respond in person when there's a youth in crisis in a community. So what makes mobile crisis different than any other service is that they can go out to the child at home or at school, in the community, anywhere that youth is needed. And they are currently contracted to respond to any call within 45 minutes. How do I know when I should call 211? You should call 211 if you feel that there's a little one in your classroom who's in crisis. If sometimes their behaviors are just a little bit difficult for you to handle. Sometimes that means that you have got a little one in the class who is presenting as a danger to himself, to someone else. This little one may be acting violently. He or she may be very angry, behaving in dangerous activity. You may realize it's a mental health crisis, or it may just appear to you that this student of yours has something else going on that may be beyond your control as a teacher to help him or her process. Sometimes you may know of some victimization that this student has gone through, and other times you may not. What we would suggest is any time that you're concerned about a child, that you call 211 and that you speak with the clinician and not allow the clinician to assess the child and assess whether or not he or she needs any kind of mental health or behavioral health intervention. Anytime that you may be at the crux of calling 911 for help for a child, whether that's for police intervention or some kind of emergency department request for a little one due to behavioral health needs. You can still call 211 even if you need to call 911. That doesn't preclude you from using the clinician to come out to the school to help both the youth, but as well as the police and any school staff who may need assistance responding to a child's behavior. So when you realize that it's time to call 211, what do? You dial 211, and then you follow the prompts to press 1 for crisis, and then press 1 again for mobile crisis. So 211, then 1, and then 1 again. If you don't press those 2 ones at the end, it will delay your access to the service. So once you call 211 and you speak with the call operator and a decision is made to transfer your call to the clinician, what kind of responses can you expect? Sometimes the clinician is going to offer a mobile response. And what that means is that the clinician will meet the child at whatever location they're at within 45 minutes of the phone call. At that point in time, the clinician will do a face-to-face assessment of the youth and will make some decisions and recommendations for next steps in terms of keeping the youth safe and making sure that he or she gets the follow-up care that's needed. There are some times when the school may call and the youth isn't necessarily an imminent crisis, needing mobile crisis to come out within 45 minutes, but may say, can we schedule a time for mobile crisis to come out in the morning because this youth had a really difficult time at school today and we're going to need to create a plan ongoing. And sometimes mobile crisis will schedule a deferred mobile response. There are other times when mobile crisis will not go out in person because the situation doesn't warrant it. And in those situations, they do offer telephonic and even sometimes telehealth responses when needed. What happens after you call? So again, the mobile crisis clinician will come out, will meet with the youth, will meet with the family, with the school, if that's where the response is happening. And most often that youth will be referred for some sort of follow-up mental health care. That follow-up care should always include the caregivers and the community-based supports, including the schools, whenever possible. Again, mobile crisis clinicians are available to help schools establish a safety plan for the youth while they're in school. Now I'll turn it over to Jasenia.
Thanks, Yvette. So I'm going to talk a little bit about how mobile crisis works in collaboration with schools. In Connecticut, Public Act 13-178 was passed and required that mobile crisis develop a memorandum of agreement, an MOA, with each school district, charter school, or other school in Connecticut. The MOA facilitated improvements for coordination and communication for mobile crisis in schools to promptly identify and refer children with mental, emotional, or behavioral health issues to the appropriate treatment programs, and also to plan for any appropriate follow-up with the child and family. Currently, we have established MOAs with almost every school in the state of Connecticut. And now some other forms of collaboration I'm going to talk about is a couple of projects that we have been able to do. In Waterbury last year, Mobile Crisis piloted the Project Waterbury for the school year. This was a way for Mobile Crisis to provide support to the schools. The project entailed that once the participating schools had exhausted their policies and processes to reach out to students who were not attending school, and the schools were not able to connect with the student or family, they would pass that information over to the mobile crisis provider in Waterbury, and then mobile crisis would call the family. And if they were not able to reach the family as well, they would go out to the family's home and provide the family with resources and supports and connect them back to the school. This project, like I mentioned, was only for the last school year. Another collaboration is through the School-Based Diversion Initiative. And this initiative has been working with middle and high school students for more than 10 years. The project works on reducing the number of students who come into contact with law enforcement and the juvenile justice system, and also looks at in-school and out-of-school suspension data as well for students. When we work with the schools to building knowledge and skills among staff to manage and recognize behavioral health crisis in schools. And through this program, we link students to appropriate community-based services and supports such as mobile crisis. In 2015, the state of Connecticut passed legislation, PA 1596, banning suspension and expulsions of children in preschool through second grade, except in those cases where the child's conduct was violent or sexual in nature that endanger the child or others. The ban was a direct result of the increase in number of suspensions, over 10% among children under the age of 7. So due to this legislation, the SBDI model has made some adaptations to the model to work with elementary schools, known as SBDIE. We have not piloted this model yet, but are in the process of piloting SBDIE in elementary schools in the next year or so to address the social, emotional, and behavioral health needs of younger children, with the purpose of diverting them from exclusionary discipline and connecting them to services such as mobile crisis and other services in the community. Another project in collaboration with working with schools has been Crisis Intervention Youth and Law Enforcement Program, CITY. This program is facilitated by the Connecticut Alliance to Benefit Law, and it brings community and law enforcement resources together to address common issues related to mental health. Their strength is in the ability to bring people together from diverse perspectives, like school staff and law enforcement, committed to working collaboratively for the common goal, which are our students. Within the framework of the mobile crisis MOA, we're able to work collaboratively with the schools in a number of ways, like I mentioned, through the projects I mentioned previously, and also mobile crisis responds to on-site requests to intervene with students in crisis and by providing them on-site clinical interventions and supports to students. Mobile crisis will also provide consultation to the school staff when there is a major school event like an untimely student death or suicide. Services and consent. School staff can request to have mobile crisis go to the school when a student is in crisis. And while it is expected that the school will contact the parent or caregiver first when there is an emergency, mobile crisis can still see the child in the school if the parent and caregiver cannot be contacted. We believe it's best practice to consult the parent first to receive consent. And if the parent declines services, mobile crisis will not be able to continue the assessment. But mobile crisis is also available to participate when the schools want to convene a crisis planning meeting regarding a specific student and provide support to the school staff. So I'm going to go over, walk you through a quick scenario. So if you have let's say we have a kiddo in the school who is kicking other kids or throwing some tantrums and seems like something is not quite with the student, it's a constant behavior that you are seeing, this is a time that you can contact mobile crisis. A lot of times we see with our little kiddos that they start displaying these behaviors, and sometimes it's due to some underlying trauma that they might be experiencing. So this is a time that you can have the school social worker or the principal contact mobile crisis. Then once mobile crisis is called, mobile crisis will speak with the caller, whether it be the school social worker, principal, and also the family. And then mobile crisis will assess the student. Mobile crisis will go out to the school or to the family's home. And after the student is assessed, a crisis plan is developed to help the student use coping skills and supports. Recommendations for treatments are then made to maintain stability and minimize risks at the school. Again, mobile crisis is here to help our schools to provide them with the support and services needed to help the students in Connecticut. And here are our 6 providers across the state that provide the service. We have Middlesex Hospital, United Community and Family Services, Wellmore, Child and Family Guidance Center, Clifford Beers, and Community Health Resources, and Wheeler Clinic. These are our 6 providers throughout the state. And then I'll turn it over to Yvette to talk about other mental health resources available.
Thank you, Jasenia. So we're going to wrap it up with leaving you guys with a few resources here on where you can get some more information on behavioral health services available to students, especially those in pre-K to 2nd grade. We talked today about mobile crisis. 211 is also a great entry point for services, and you can either call yourself or you can refer families. Suicide prevention is available for students in Connecticut. We do offer, our suicide prevention line offers support for children as well as adults. It's another resource that can be used, and unfortunately right now we are seeing the need for it in this young population. Connecting to Care is a final website that has links to a whole host of behavioral health services in Connecticut. And again, families or providers can go onto the website, select the town that you're looking for services in, and it'll walk you through a whole bunch of options you have there. Lastly, Jasenia mentioned she works for CHDI, and they're a performance improvement center for many of our services here in Connecticut, including our crisis response. And they do a great job of collecting data for us and analyzing that data. They also do some really great reports on a lot of the programs that we're operating, and it shows a lot of the success rates and some of the stories behind the data. So their website is there, and it's a great resource to get some more information. So thank you everybody for participating today. We appreciate your time. We hope that we shared some valuable information for you, and we encourage you guys to reach out to 211 anytime that you need to.